estás com a minha mãe? Então, onde é que está? É tão lindinha.
Yes, we're streaming. We start now.
Tá bem, meu bem? Até logo. Beijinhos. Até logo. Até logo. Até logo.
So requesting everyone to come back into the room. We are looking to summarize. So let me ask everyone to come in and take their seats, please. So, yeah, and just I will maybe just thank Kena later on. So just deal with Sylvia when we are doing the logistics.
Okay, so you.
Okay. So I think the logistics will go. Thank you. When we're doing the logistics, I'll address that one.
We make a good
The stream is better on the top.
Okay. So,
Should we both just go up?
so what we are saying
Dennis, you don't need me for now. I'm just going to be at the back and start the support group. Yeah? I leave those questions on, yeah? And Susan, we're finishing at 4:30. So but you said you were having open questions. You're having a discussion 20 minutes and then
a bit of a discussion, yes.
and then 10 minutes for questions and then 4:30 wrap up, yeah?
I think so.
Yeah.
So, I think that what we're going to do is course, we love the discussions. We don't think that. So, in terms of, you will be panning the camera.
I have three. This one, or the folio is better.
Eles têm acesso ao e-mail que eu enviei aos a parte da entrada. Pronto, a Inês, ele era a favor do pico cada uma delas. Se é mais fácil.
Okay, so we are coming to the final part of the session today, and prior to going out for coffee, we had the discussion groups. So we are going to hear some feedback or some key highlights from that. I've been told. Hope I don't fall over again. So we're going to have feedback from the sessions. We don't intend to keep you here longer than necessary, so let's try and make this as effective as possible. We are going to have feedback from the three groups, obviously, and then we'll just have a very short discussion session, which is going to be open to everyone, to just see if there are any sort of ideas, common ideas or common themes emerging from the discussion groups. And Susan is going to lead this. I'm going to ask Harvey Kennedy. I'm going to ask, so Harvey to come up. He's going to lead the feedback for the session, for the second session. So I don't know whether you want to do it from there and then you come up. Angelina, yes? So Harvey, come over. So Angelina and Cham and Susan is going to moderate this session. So I leave this in your expert hands.
Thank you very much. So if we can start, I think Ben, for group number one, who's going to start with feeding back here? The two of you. Wonderful.
Yeah, so we just wanted to say that for our group, we have 3 people who are going to feedback. We picked on 3 key points. So we've got Ben and Moro, Tatiana and Litonde.
And we agreed that we would start on this enabling policy environment, and that Mauro would start on the priorities and the barriers, and then I would talk about the actions.
So yeah, it was a group discussion, as we are all aware, so it was not from me. I'm going to read from what the group has discussed and agreed. I mean, not to agree, but it's open to us to decide on. So on the priorities and barriers, we have asked every one of us from our various parts of work, from our various communities, what are our priorities and barriers. So we came across this, which says lack of access to information services for migrants. And we also mentioned lack of data to inform advocacy, which is hard to reach. We also have regularization. I mean, that was from me. I always say 2 things. I mean, in order to avoid all these problems we are going through, we just have to regularize migrants. They just have to be documented. Because if they have status, I mean, they will be able to go against those struggles and challenges. And also lack of representation at decision-making tables. In most of the time, things are discussed without involving us, about migrants, issues of migrants. So I think it will be very important and relevant to have us on discussion tables like we are here today. Imagine this is EU Parliament. We are there representing us and speaking about our problems. We also talk about negative inciting use of language about migrants and against migrants. We also mention far-right weaponizing migrants, as she has mentioned here. Italy is signing, as we are aware today, Italy is signing this memorandum which is there to push migrants from taking the route from from Libya to reach Europe. So which means there is a far right, in Italy, which can be expanded to all over Europe. So we have to be careful about that. That's also a barrier. We also talk about inequality treatment and prioritization of different types of migrants. I mean, in Berlin, we call it divide and rule. We have this. We had this in 2012 where Syrian refugees came and refugees from other parts of the world. So we have a term called divided and rule, good refugees and bad refugees. So in most of the time, we fall under the category of being bad refugees. So this is about the barriers and the prioritizations. So maybe you would like to talk about actions.
And thanks. We stated as a key action a notion of accountability, both from the community and from the policymakers. Remember, we're talking about how to enable a policy environment. And there was a recognition that sometimes we want to encourage activity from the community, not passively complaining, but actual engagement. But we also want to make sure that the policymakers are actually monitoring and being accountable for what the data actually shows. I think Mauro said it best, that this whole idea of regularization, these are great suggestions, but they all really come down to this idea of a language shift or a concept shift, that we not talk about hard to reach people, but find them. That we not talk about people going to services, but that we talk about enabling services. So that, I mean, Paula is nodding her head. I actually have you in my notes, Paula. Paula's example of going to test sex workers at home is a really good example about giving validity to migrants' spaces, migrants' areas. We talked a lot about slum areas, about really having people basing their services and providers being in those areas. We talked about funding for community-led research so that people would have a better understanding of what migrants actually want, need, and can understand. We talk about sort of roadmap and guides to low threshold services and change making. People really felt it was important for migrants to understand the whole process of how laws get made, how policies get made, but also how they access services, to understand how the hospital system actually works, how the healthcare system works, and to make it more available to them. And increasing the profile of migrants in civil society organizations. There was an acknowledgement, I think, I can't remember who said it from the stage, but the idea that our own civil society organizations don't often place the importance of migrants and sex workers in our own policy making at the community level.
Thank you.
Does anybody have anything to add from our group?
Yeah, wonderful. Thanks very much. Does anyone else from that group like to share some of our other points? Yeah. Oh, sorry, it's Tatiana and, yeah, Letunde.
Who do you want first?
So some of the points that have been mentioned here are somehow the same. I'm trying to keep it short. In terms of access to healthcare, the priorities are we need more data. So data on chemsex, mental health, HIV, and migrants. There is lack of data in all fields. Addressing barriers of access. So it is general barriers for sex workers, for undocumented migrants, and for trans people, but also intersectional stigma is one of the barriers. The other issue, which is a priority, is advocacy and agenda setting. So prioritizing HIV as HIV prevention and care as a priority for healthcare priority for migrants, maternal support. Where is it? Yeah, maternal support, and also representation and visibility of groups. And the last one is clear, accessible information for migrants and accessible services at entry point. So the actions that should be taken are a more robust data collection, but it is not limited to data collection, but also to follow-up and implementation. Positive, non-discriminative language use, more coordination between and communication between different services, involvement of community-based organizations, and then we discussed that just involvement is not enough. It is about leadership, so they have to be really take the lead in designing, delivering, developing, delivering, and reporting. But also, and one of the important issues is funding, so that's why it is 5 times here repeated, because funding is very important for all of this. And
Angelina's got terrible handwriting. I apologize on her behalf.
No. And effective advocacy and activism, so empowering communities to be able to advocate for their rights. And the last one is documentation of regulations and process. I am not sure what it is. Regularization. Oh, regularization, yeah. Okay. Yes.
Lovely, thank you. Thanks very much. Can we have Letunde now, please?
Yeah. So the last discussion was on strengthening community involvement, and the priorities we listed was on what works. So involving community cultural mediators, which also means mentoring, navigation, peer education. That is putting people who have the experience in the first place to talk about their experience, and also to involve other migrants and migrants in a broad sense. So it could be sex workers, asylum seekers, and all what you have. Then linking NGOs with funding streams and services at a local level. If someone wants to integrate on this. And then we have collaboration between formal and informal health facilities. So one point was that many CSOs offer health services, offer low threshold services, and they are like kind of informal health facilities, and they should be linked to formal health facilities. This is an experience we have in Trieste. Let me just break in. And we have lots of migrants who come over from the Balkan route, many Afghanis and Pakistanis, and there's a volunteer organization that's in front of the train station in Trieste and that offers low health services, threshold health services to these people who want to continue their journey. And very often we call on this organization to also link them to public health services. Then we have having visible positive models among, which is linked to the first point, to migrants. So having visible positive role models. Then upscaling new role models, that is passing over to younger generation for the old ones to step back. And I put myself in the old ones, so don't feel offended. Then empower through education and funding by using social media and making it accessible also to the migrants. And that leads us to the actions. And we talked of provision of low threshold facilities like health buses to the communities, so reaching out to them and not making them come over to us. Accessibility in all senses, which is very important. And the last thing was this app, GPP app, which is linked to using social media. So the Global Passport Project is one of the, is an app that was kind of created, I don't know how you say it, by an Italian organization called Cosmo in Naples. And Tampep International Foundation asked Cosmo to add an app, to add a red umbrella icon for sex workers. What does this app do? It gives migrants the opportunity to save all their documents, their papers on the app, and so that they will not risk losing it. Someone earlier this morning talked about not having your papers or losing them. With the GPP app, it's possible to save everything on the app and then travel across Europe. So the red umbrella icon is also to provide information for sex workers, migrant sex workers across Europe to know where they can get information on health services or legal systems, etc. Thank you.
Fantastic, thank you. Can next go to Cham, who's going to share the insights from your group.
I'll use this one. Hi, everyone. Thank you for that. You might change your mind after I'm done, and you'll be like, you made that all up, none of us said any of that. So we ended up really kind of flowing like a river, going back and circling on ourselves. So I think, first, I think we all agree with everything that's been raised by that group, and we support it. We raise a lot of this similar things. In terms of, we talked for a while, and then we sort of realized that ultimately there are a number of underlying issues that affect every part that shapes the priorities that we have and the actions that we want to see. So the fact that ultimately the issues faced by migrants stem from their immigration status, their poverty, inequities, discrimination, and stigma that they experience, and overwhelmingly and universally across Europe, a hostile political environment that's driven by xenophobia. And I think that Jackie in our group really put it well when she said, in terms of what we need to do, we really need to see how we can frame migrants as a solution and not as a problem. So yeah, those are all words from them, and I'm really just parroting that. So, so I think that's kind of how we ended up contextualizing everything that we suggested. In terms of access to services, we spoke about how we need to have better cultural competency training for healthcare professionals, and we need to address structural biases and frameworks and setups that are top-down, that are not really tailored or driven by the actual needs of migrants, but they're just what people think migrants need, which really echoes what you said. We talked about universal healthcare access and how that's lacking, and you know, for migrants, and that should be a key priority. We spoke about institutional bias and lack of diversity in in migrant provision services, and then we also spoke about the fact that people work in silos. So either you're working in healthcare, or you're working in migration support or social support, and that there's a lot of lack of information, lack of awareness among healthcare providers, law enforcement, social services about the issues that migrants face, or about the health issues like HIV. And we also, yes, said there's a real lack of data as well across the board. So in terms of the actions that we wanted to see, it included calling for a more unified guidance and laws at the European level to have a more consistent approach of legalizing and regularizing migrants that can be used as a tool to advocate where the system is set up to actually restrict migrants' legalization, so that it can, you know, everything is standard. It takes a month to process them as opposed to 3 months or 5 years, you know. So, so just having the laws at a European level to really help national advocacy efforts. Increasing access to social services with housing, employment. We spoke about having a more streamlined process for validating people's educational certificates from their home country, and a lot of other factors as well. We spoke about the importance of focusing on people living with HIV specifically, and having that as an emphasis, because it's very easy to then, you know, go very broad brush. And so how we can support and empower them to be involved and engaged and kind of at the heart of all of these actions that we're proposing. We spoke about having resource centers that are pooled, that are, you know, maximizing our resources, and you know, because a lot of the issues we mentioned priority of, say, language, so a lack of resources in different languages. So how is it that we can have like resource hubs that kind of address some of those common challenges? You know, we spoke about training and raising awareness. So how can we have a common place where we can actually all make use of that? And in terms of the policy environment specifically, we spoke about the importance and the power of organized communities and collectives to help us avoid silo working, and to have that at both a European and a national level. We spoke about engaging and lobbying policymakers as individuals. We spoke about how actually we're really lucky because we do have some strong allies who are policymakers. So building on those relationships as well as cultivating new ones. There was a suggestion we should really encourage each other and the migrants, the communities that we are in at the moment, to become the policymakers, to stand. Because I think, and for me, that actually I was surprised by that, because I thought, oh, I never thought of myself as a potential future policymakers, as a, and why not, right? Why not be in that? We talk about being in that room and being at that table, but let's put ourselves forward to be in those positions. So I thought that was very, very powerful. And finally, we spoke a bit about data, and data in terms of its collection or lack of it, but also in terms of the protection, like people's concerns, how that affects access because they're worried about their data. Is it going to be collected? Is it going to be shared? So there has to be really strong data protection policies and laws that protects their confidentiality, but at the same time that we need to have very robust systems that collect the data so that it can inform the policy, because if the invisibility continues, then the problems will continue. I think that's mostly
Wonderful.
it.
Thank you so much, Cham. And next, talking about working across many different organizations, it's perfectly apt to have Harvey, who works everywhere, essentially.
Feels like it. Luckily, I'll be feeding back what others have said, not talking about what my opinion is necessarily. But I do want to just start by saying that one of the key learnings from our conversation was that context is so important, and that actually we're all from different contexts, despite speaking on a quite a global level. We want to try and imagine that there's one solution, but really that context is the ultimate decider of what's going to work and what's not going to work. And so I'm going to share some of the feedback from the group with that in mind, but please keep the context in mind that one recommendation might not suit all contexts, okay? So the first thing I'm going to do is I'm going to break it down to 3 areas. The first key priority area was awareness and accessibility. And to just expand upon that a little bit, that was in the form of sort of culturally appropriate translation services, but also method of signposting. So thinking about what we're signposting, for who, to where, and with what in mind. So if we're signposting to a service that's got a poster with someone on it that does not represent the person who we're signposting on behalf of, that's probably not going to be a good move. The second one there is, first one, sorry, links to access to healthcare, things like waivers, reimbursement, social insurance for individuals without bank accounts or addresses we heard earlier on from Kim. And also thinking about service awareness in terms of safe spaces, not just spaces, but safe spaces or safer spaces. Thinking about joined up care, it says cultural competency, but I think we need to be thinking about cultural humility, because we can't become competent in other people's experiences. We can't become competent in someone else's experience, but we can be humble to the fact that they've had an experience that we might not understand, okay? But also thinking about some of the rules that are sort of tied up in how we make decisions. Secondly is a really robust public policy, and that's something that we described as, in terms of action, something that's community-led, so community-based participatory research, approaches that are context-appropriate and reflect in both policy and the process around how we do that thing. So the policy is one thing, and then how we go about doing that or processing that is another thing, and doing that in a way that is long-term and sustainable, not in the short term. In addition to that, there's also issues around gatekeeping. We spoke about entitlement within decision makers' capacities. There's lots of people who are entitled who are making decisions for those who are not entitled. Those who are privileged are making decisions for people who are not as privileged, and how that can impact things like GP access or access to your general practitioner or doctors. We spoke about stigma as well. That could be in terms of gender, it could be in terms of sexuality or some other area, but stigma certainly is a central point of how policy is formed. And then the third thing here is thinking about things like the medical curriculum, which guides a lot of the decisions that are made in terms of the health of migrants. And to ensure that there is not just trauma-informed training, but incentivized trauma-informed training that impacts curriculum development and ensures that there is a high quality in the continuity of care element of those recommendations. That it also addresses stigma, in terms of HIV, in terms of Islamophobia, homophobia, things like ableism were not brought up, but can also be added to that list. And also thinking about things such as what that baseline looks like. So we collect data or gather information to inform the decisions that we're making. What is the baseline and where does that context of that baseline sit? So when we say, this is what we know, how do we know that we know that? And what evidence do we have to support the fact that we say that we know that? And so that was basically the summary. I hope that wrapped it up nicely. But I'd like to welcome anybody who feels like something might have been missed from my group to just pipe up and say it now in case I've missed it, because I think that we've said a lot of important things. I can see some nodders in the back who might want to...
Would anyone else like to add from any of the other groups some of the issues that we discussed? No? Anyone? Okay. I've got menopausal eyes, so I can't see properly. And don't turn to you, Angelina.
They're just debating. They're just debating.
If no one has would like to add, I'd like to just build on some of the issues that have been raised. One thing that seems to be a threat to so many of us across so many different regions is the hostility towards people from migrant communities, the increase in racism, the weaponization of migrants in the media. So a really big question, but I'd like to open it to you all. If anyone has any potential solutions, what we can do to fight that. Yes.
We also briefly touched upon this in our group, and one of the solutions put forward was really to focus on what migrants actually can bring in, what they can contribute to society, and focus on that, promote that.
Right.
But I know it's not an easy solution, of course.
Absolutely. And panelists, do you have any thoughts about how we can fight against that?
Well, we know it's a solution because we see people utilising migrants from other countries to support their health infrastructures all the time, don't we? So a good example is the NHS. The NHS would absolutely collapse if it did not have all those migrant populations coming to run it. So we know it can work, and we know that we're aware of it. Yeah.
Sorry. I think, yeah, I think we touched on it. We talked about like being able to emphasize the value that migrants bring in the different spaces. I think that's very important, and it's really critical. But I also think that at the same time, we shouldn't have that expectation that you have to prove your value. You know, I think it's something that a lot of people from migrant back, you know, you have to work twice as or 3 times as hard to be seen as equal. And so, yes, it's important, but at the same time, why should we fight to be seen? You know, why are we bad refugees? Why aren't we all good refugees? You know, I think we have to be more vocal in how we call it out. And I think while economics will always be the winner, in terms of making that economic argument, I think that has to go hand in hand with being able to call out the unfair treatment of bad refugees when we see it, and we have to have a more consistent approach.
Thank you very much. So I guess we've spoken from the national level of organizational level, and also what we can do to call it out. But I just want to focus on the individual level in terms of looking at the migrants themselves, because there is the issue very similar to what you can experience if you have HIV, which is self-stigma. So there is a self-stigma around HIV, but also the self-stigma of being a migrant or an asylum seeker. So I think the things that we can do from a personal level are similar. So firstly is around enabling, skilling up, training, and giving confidence and skills to migrants and asylum seekers to change the way they see themselves, because society sees us as this negative thing, but actually if you give a person the abilities and the skills to change the way society sees them. But also the other thing is around alluding to what Chama said, is around when you're enabled and skilled up, you can then kick the racism, kick the stigma out of your life. So then you fight back and you push back, so that when you see yourself just as able as any other member of society. And I know it's hard when you're struggling with finances, with housing, with whatever, but actually, if you can change the way you see it and fight, like for example, with HIV stigma, when somebody stigmatizes against you, I always say, you know, if somebody doesn't like the fact that I live with HIV, I ask, do they pay my rent? Okay, maybe they might do. Do they school me? If they don't, if they're just being, maybe it's the media or somebody just being negative about me, if they don't directly affect my life apart from just being negative about me, then I don't need them in my life. And I know it's hard to do when you're struggling, but actually it's just about that confidence to actually say no. I am better than this. So I think that's just some of the things around just confidence building and upskilling people to be able to fight back against the stigma that's directed at us. Because as you've said, without migrants, not just the UK or the National Health Service, countries across the world would collapse. If migrants in any country in this world decided for one day not to go to work, one day, not 2 days, not 3 days, if migrants didn't go to work for one day, countries would collapse.
Absolutely. Thank you so much, Angelina. I think that's an extraordinarily important point. As a black woman with HIV, I'm really conscious that we're often perceived as passive, voiceless victims, but I think that's so far from the truth. I think, Angelina, everything that you say is testament to our power and our resilience. And I also think in terms of when we are involved in the media, when we're involved in working with other organizations, we should resist being used as case studies. We need to be recognized as the experts that we are and be paid appropriately for our time. Is there anything else anyone would like to add before we close the session and have a few closing remarks?
Maybe I just give a comment.
Absolutely.
So about this self-representation, I always emphasize on that, we have to represent ourselves wherever we are, we lead ourselves because we are experts of ourselves. I mean, I would say my health, I think it's a very good way of starting it, being represented by a person like him and together with others and organizing such a conference like this. If we have similar or many organizations, initiatives like this, in all over Europe to have this access. But we can't also do it without funding, which we have also emphasized there. There's supposed to be funding. And most of the time, there are more migrant-led organizations, but they lack resources, to go. I personally, speaking to you, I'm part of it because I came to Europe in 2015, 2016. Together with two guys, we formed a community radio. So because we have been always told by media, by people every time going, interviewing us, we say instead of waiting for journalists to come and interview us, speaking about us, why not we have our own media platform? So we were able to create a radio station and it's still working until now. So, I think that there are ways, but definitely we need support, and this support is resources and funding. So thank you.
Fantastic. And talking about funding, I'd like to thank Sylvia Alfred from Gilead for supporting this event. And Sylvia, I'd like to hear from you about why supporting this event was so important to you.
Thank you. Can you hear me? Yes. Well, let me firstly say thank you for inviting me to this meeting. It's just been a real privilege to be here amongst you and hearing some of the great work that the MI Partnership has done and all the other contributors. So thank you for that invitation. Of course, funding is always going to come up when we speak about health equity, when we think about trying to reach key populations, because it has to be done by somebody. And you already alluded to the fact that, you are experts, you know your communities, you know the work that needs to be done. And, that work cannot be done by itself. It needs to be supported, and we recognize that. And I'm so proud to have been able to have in part supported this event. I know that there are other contributors and also support the work of the Zeroing In program, which was the program that really reflects all of the work that you have done on the ground. So it's amazing work. We know that there's still very much more to do. I am second-generation migrant to my country, so we understand the challenges that are faced, and so the work is important. It needs to continue, and please come to us if you have ideas, innovations in this space. As Gilead, we're always willing to listen. We're always willing to partner to make the changes that we want to see. So I will just stop by saying congratulations to you all. It's been an incredible event. If you want any information around funding or around what we do at Gilead, then I can provide the details for that. For those of you that don't know very much about Gilead, Gilead is a biotech company. We specialize in making medicines to treat HIV, viral hepatitis, inflammation, and oncology. We've been around for the last 30 years. I've been in the community working for Gilead for about 20 of those years, and working alongside many of the groups that are represented here, and that still remains an honor to be able to do that. At Gilead, we're trying to drive health equity. We want to see health equity in the spaces that we're in. I think it was Christine that mentioned this morning, this is not just about giving people pills and walking away. This is about how people live and how they access care and how they access services. And that's what we need to focus on if we're all really serious about ending the epidemic in 2030. So I just want to extend this invitation to you. If you are thinking about funding, if you have projects or ideas, then please feel free to come to us. We will listen. And as I say, we always value your partnership and the work that you do on the ground. So I'll stop there.
Thank you, Sylvia. And back to Dennis.
There are a few practical questions, information I'll provide later. And I'll let Susan close that session. But what I want to do is to take this opportunity to introduce our chair, the chair of our organization, Zukena Yoha, who has made time to travel from London. Zukena has been in this sector for a long, long time. She was a former public health commissioner, so she worked a lot with organizations, including a time when there was no treatment. So she really, listening probably 20 or 30 years later, she must be surprised that things have not changed much, but, but she's there. I just think that what I'd like to say is that we have, we're going to have dinner today at 7 p.m. So it's not far, it's just about 2 minutes walk from here. So I request you to gather in the lobby at 6:50 so that we can just go there by 7 o'clock. The other thing to say is that we are going to be offering some reimbursements for some of the expenses, like transfers from the train station to here. So we will give information. I think that we might do that this evening, just before we depart, around 5:30, if you have any expenses that you'd like to claim, especially those ones who are leaving like this evening. But otherwise, if you're here, we'll still do the reimbursements tomorrow as well during the breaks. So that's probably what I have to say. And of course, just to reiterate my thanks for the session today. I know it's been very intense, and we've really been patient. The one tomorrow will be a bit shorter, 3 hours. So, but I think that your ideas and your contributions have been very immense. I think it's just we have to continue working together because we don't have many opportunities. This session we have done, this summit we've done is the first of its kind on HIV and migration, and we want to push it. So we hope that we can do this annually to keep making noise as much as possible. We know that there are still people who are critical to the discussion who are still not engaging with us. So we need to be able to make a lot of noise. But most importantly, I think that we should be able to link together and keep, these conversations going. So that's all I can say for now, and I'll return the mic to Susan to close the session.
Thank you so much, Dennis. And I would like to say a huge thank you to Dennis and to all the team for putting on this absolutely tremendous event. I've worked in HIV for 20 years. I started when I was a very small child. But I think there's so much passion and knowledge And it's extraordinary to come together and to learn from each other at this absolutely brilliant event. So thank you, Dennis, and to everyone who have been involved, and for all the organisers and all the sponsors, and for all of you for giving up your time to come here and share your crucially important insights. And I will see you at dinner at 6:45. Thank you.